Hi, Dr. Kevin Windisch from Sparks Pediatric and Adolescent Medicine. Welcome to our video series for parents. Today what we want to talk about is a little bit more first aid for you. We want to talk about first aid for basic cuts and scrapes. Summertime's here, kids are playing outside, people wind up running into trees and riding their bikes and scraping their knees up. So what do we do for these things? Well, I think it's important to address. Please remember that these videos are not intended to replace visits to a physician. If you have questions or concerns, we're happy to see you here in our office. We'll get you in the same day if you need to be sewn up, sutured up, stitched up. We'll take care of that here in our office. Same day area code is 775-359-7111. Please realize we really can't help you over the internet or via the telephone. That's bad medical care and by definition unethical. So what do we do? Well, most of these things in reality are not severe. And so the children, although there may be a lot of blood, will probably not bleed to death in front of us, assuming we have a child who does not have underlying bleeding issues. If your child is a hemophiliac or has low platelets for some reason, please contact your physician right away. So, since they're not severe, the first thing to do is to settle yourself and the child. It's hard to take care of a child who's screaming. It's hard to take care of a parent who's panicking. Once you have the child settled down and yourself settled down, you can then assess the wound. If it is a superficial wound or a scrape, the thing to do is to wash it under running water with soap. Now, this may sting a little bit, but you've got to get all the debris out. Debris is the cause of infection. If you can get the debris out, you're much less likely to have an infected wound. If your child has gravel embedded in the skin, that's got to be removed. If they have road asphalt embedded in the skin, that will result in tattooing of the skin, and it'll be permanent. So you've got to remove that. That may involve taking a washcloth and rubbing it roughly across the abrasion. If your child can't tolerate this, that's a reason to go see your physician or go to the emergency room, where if need be they can do it under anesthetic and clean this up. Small superficial cuts can then just be closed with pressure and a sterile gauze and then a Band-Aid later once the bleeding is stopped. So to obtain the pressure, take a 2x2 or 4x4 gauze, fold it up, put it over the wound, and hold it on tight until the bleeding stops. If the gauze saturates, put another gauze on top. Don't pull the old gauze off. That will, if you pull the old gauze off, it'll pull off any clots that have formed and the bleeding will start fresh. If the wound is gaping, if it's deep, if you can see bone underneath, or muscle, or fat, that's a reason to come see a physician. The wound may not be serious insofar as it may be something they're able to suture up, but it's something you still want to pay close attention to. Wounds on the face, if you're not sure, see your physician. Suturing a wound on the face will get you a better cosmetic outcome if it needs suturing. And faces are all, are the thing we look at. They're the face, your face to the world. So if you're afraid that there's going to be a big ugly scar, see your physician. If it's something that can be sewn shut, it should be. You'll have less scarring and a prettier outcome later. If it's a deep puncture wound from a nail, from a bite, that needs to be scrubbed, it needs to be irrigated. Those need, again, to be seen either in the physician's office or the emergency room. Human bite wounds need antibiotics, so do animal bite wounds. So do nails that have gone through the shoe or through your flip-flop because they take bacteria with them. So if you have a puncture wound like that, please see your physician. You need close, careful follow-up and probably some antibiotics. Once the bleeding from these superficial scrapes and cuts is stopped, you can just simply put a Band-Aid on it. The Band-Aids really keep the dirt out. There's nothing special about that. And once you get a nice clot on top of that, then realistically some antibiotic ointment, either bacitracin or polysporin, is probably a good idea to keep the clot soft so that it doesn't crack and re-bleed, because that hurts. Here in the desert where we live in Nevada, that's really important because those clots will crack and re-bleed and ooze for days on end, and it hurts when it happens. but keeping either some polysporin or bacitracin ointment on will prevent that for you. I do not recommend Neosporin, which is polysporin plus neomycin. We see a lot of contact allergy from neomycin, and if you get a contact allergy on top of a superficial laceration, your risk of scarring goes up. So polysporin or Neosporin, both of which are over the counter in the United States, you don't need a prescription, a couple times a day until that clot has completely healed. If there's a small scar afterwards, some over-the-counter Mederma, which you can buy at any pharmacy, helps to make the scars a little bit smaller and to fade. Keep the scars covered with sunscreen. You don't want them to burn. If a scar sunburns, it is more likely to be permanent. If there is a ton of bleeding, if the bleeding doesn't stop, if you get green or yellowish or bad-smelling discharge, if you can't get the wound clean, or again, if you see muscle, bone, fat, or are just not sure what's going on, or if the wound is gaping, come see your physician. We can clean those up, and if need be, get some stitches in there and bring the wound together and give you a nice cosmetic closure so that you don't have a big ugly scar. I hope this helps, and I hope this demystifies some basic first aid that's very common during the summer. If we can be of assistance here, please give us a call at 775-359-7111. We'll get you in same day. We'll get you sewn up. We'll drop what we're doing to stop your bleeding. We'll see you next time.